Miss Wallace!
Dr. Culver, what are you doing here?
This is a hospital, Beth. This is where I work when I'm not in my office.
Oh, of course. Well, listen, have a good evening, okay?
Not so fast, Beth. I've got a few questions that have never been answered to my satisfaction.
Oh, really?
Really? About your so-called pregnancy? What's going on with you, Beth?
Really, Dr. Culver, I don't know what you're talking about.
You know damn well what I'm talking about. We discussed this before. You showed up in my waiting room one day looking quite pregnant when only a few months earlier at your annual exam you most certainly were not with child.
Well, there's plenty of women that get huge long before they're going to deliver their babies.
Baby,
you know?
Miss Wallace, or the sack of sugar you were wearing around your waist to make you look pregnant? What kind of twisted stunt are you trying to pull off?
Well, your nurse must have me confused with one of your other patients.
Not a chance. She's quite certain it was you who walked into my waiting room wearing pounds of sugar around your middle. What on earth were you thinking?
You know what? I gotta get going, Dr. Culver.
Dr. Culver. Ethan Winthrop.
Oh, yes, of course.
My wife has an appointment with you tomorrow.
Well, I look forward to speaking with her.
As a matter of fact, she's about to be discharged. If you have a minute, she would love to have a word with you.
Fine. I'll be right here.
Great. Thank you.
Sure. Oh, Miss Wallace!
I really have to run, Doctor.
Oh, what a shame. I'm about to speak to a friend of yours, Gwen Winthrop. I wouldn't be at all surprised if your name came up. Can't stick around. I gather Gwen Winthrop has some questions about you.
Well, I don't know about what, but I can't stay, okay? I gotta run, Doctor.
Well, then I'll just do my best to tell the woman whatever she wants to know on my own. Well, it's an emergency.
Huh. What do you know? I was just going to ask Dr. Culver some questions about you, Beth.
Well, I'm afraid they're going to have to wait, Mrs. Winthrop. I have a patient down the hall in distress. If you'll excuse me. Did you happen to see the Winthrop couple, nurse?
Yes, I think that they had to leave. Do you want me to see if I can catch up to them in the parking lot?
No, it's all right. I'll speak to them tomorrow about Beth Wallace.
That's the woman whose newborn almost died recently from dehydration.
She has a baby?
Yes. She had it just a couple months ago.
You're quite sure Ms. Wallace has a baby?
Yes. He got very sick, almost died. I remember she was very possessive about him. Not that I blame her.
Thank you, nurse.
Mm-hmm.
She couldn't have gotten pregnant and given birth in such a short period of time.